Diabetes, thyroid problems, menopause, depression, hypertension, they're all common health issues that may be doing damage to your sex drive. Dr. Irwin Goldstein is here. We're going to put an end to your sexual dysfunction, help you have a healthy sex life. And will you be twittering tonight because you've got a big Sex in Our City seminar this evening?
We're going to be lecturing to lots of people tonight, so it's almost sold out already.
Yeah, and that's a good thing. We're going to talk about sexual dysfunction. I always think mainly of men when that term comes up, but it is both men and women.
Oh no, it's actually both men and women, and more women have sexual problems than men. It's just because you think it's men because we have Viagra and all those other drugs.
Right.
We're starting to get drugs for women. At the FDA soon will be the pink Viagra, which will be very exciting.
Yes, no pun intended, or is it?
It will be for women with low interest, who are really plagued and distressed.
Well, what's the common reasons for men and women, then, for sexual dysfunction, including low interest?
The classic ones are psychology and relationship issues, but we're becoming more aware of biologic issues, specifically blood flow issues or hormone issues or anatomic issues.
Now, some of these come with age.
Sure.
Right? I mean, it's like when you're first married, it's catch me, catch me, catch me. Then as you get, after years, it's catch me, I'll catch you tomorrow. But these things, do they have to happen with age?
They do not have to happen with age. We have many, many people sexually active well into their later years. It's for people who are distressed with their current function. I mean, some people get sexually retired and it's not an issue. Mm-hmm. Some people, it adversely affects who they are, their self-esteem. It affects their relationship, affects their quality of life, and they want something done about it. And at Alvarado Hospital, we have the first Department of Sexual Medicine. I'm very proud of that. It's very exciting. We have a department that's integrated and equal and respected, just like cardiology and endocrinology and general medicine.
And this is the first one in the United States?
First one in the United States.
The very first one?
Yeah, we plan to make San Diego the go-to place for the world here.
And you were telling me earlier, too, about how little we know, and even people still have questions that are so... Really, we should have been asking them years ago, but for some reason didn't. No one told us anything about these type of things, what you're talking about.
My daughter was just on the phone with me, and she's 30 years old with her own child, and she said ever since grade 5 and grade 8 was her last exposure to any information on educational basis about sexual life. So we do these quarterly seminars, Sex in Our City, and we're going to be talking sexual life, sexual function, sexual physiology, all that stuff.
Now we talked about some physiological. Some are...
So blood flow issue, like a bicycle rider.
Okay, that's good.
Would you ever think a 20-year-old kid would hurt the artery to his penis? But in fact, it happens.
And this is the culprit right here.
Yeah, so here's a pelvis. I even brought a pelvis here.
Yes, you did.
The genital bone would come off the pubic bone, but the artery to the clitoris or penis would come underneath here. And if you ride on one of these narrow things, you actually put the nose of that saddle right on the artery and nerve to the genital, so people have damage.
Yeah, and there are stories you were telling me about policemen who ride bicycles
for a living,
suing, because they have to ride the bicycle through, and we have them here downtown, and they're suing the cities because of sexual dysfunction caused by these bicycles.
Yeah, so I'm very proud to show you this. This is the U.S. government National Institute for Occupation Safety and Health, NIOSH, has put out the first ever statement on sexual dysfunction associated with bicycle riding. And it's a government statement saying beware. They have a new website, and the website will show you that a seat like this will bear the body weight without...
Yeah, this is the one. This is the one right here. So you're
maybe that's the one your aunt who drinks the Sanka coffee. That's probably what she wrote.
My mother.
Your mother.
That's right. My mother rides that bicycle. Yeah, she's 96 years old,
and she's
still riding that bicycle. That's right. Well, I don't know. I don't pry. That's my mother's business. But you can call her if you like. Okay. Now there's sexual pain. How is it cured? We don't have much time, but.
Well, I know
you can do it.
At the opening of the vagina, you can have pain, and it happens at very young age, from women on birth control pills to women in menopause where their vaginas are dry due to lack of estrogen, and we need to figure out what it is. It could also be due to fear. It could also be due to past bad experiences.
So there are a lot of different reasons for sexual dysfunction in both men and women, obviously.
And it's time to get it out in the open, make it a department status, make it just a medical problem in one roof. We have the biologist, the psychologist, the sex therapist, the physician. It's awesome.
And tonight, free seminar, 6 o'clock tonight at Alvarado.
Alvarado House, 2 hours, 6 to 8. Be there.
All right, be there or be square. There you are. Learn about it and don't be afraid, okay? Free seminar tonight. You know where it is. They're at Alvarado Hospital. And for more information, of course, you can always go to san diego6.com as well. Doctor, thank you very much.
God bless you, Joe. Thank you for doing this.
God bless you, too. Thank you.